If you're over 60 and wondering, is sex supposed to feel this different now? You're not alone. Many people quietly suffer in silence, thinking it's just a part of getting older. But here's the truth.
Sex can still be comfortable, intimate, and fulfilling even after 60. I'm a urologist who's helped thousands of men and women navigate these exact concerns. And today, I want to gently walk you through what's normal, what's not, and what you can do to bring comfort and confidence back into your intimate life. As we age, our bodies naturally go through many changes, and that includes our sexual health. It's completely normal for men and women. Notice that sex doesn't feel the same at 60 or 70 as it did at 30 or 40, but that doesn't mean it can't still be comfortable or enjoyable. One of the most important things to understand is that aging can slow down the body's sexual response. For men, erections may take longer to achieve and might not be as firm. For women, natural lubrication may decrease and the vaginal walls can become thinner or less elastic. These are not signs that something is wrong. They are part of the natural aging process. Many seniors worry when these changes happen. They might start to avoid intimacy because they fear pain, embarrassment, or performance issues, but avoiding the topic only creates more anxiety and distance. The truth is, when you understand what's happening in your body, it becomes much easier to address it in a safe, healthy, and respectful way, either with your partner or with a medical professional. Sexual desire or libido can also shift with age. Some people feel less interest in sex, while others remain just as interested as ever. It's important to remember there is no normal level of desire. Everyone's experience is different, and changes in libido can be influenced by things like stress, medications, hormone levels, or overall health. One helpful way to think about sex after 60 is this: it's less about performance and more about connection, comfort, and communication. You may not be as physically quick or reactive as you once were, but many couples actually find that intimacy becomes more meaningful as they age. There's more patience, more emotional closeness, and a deeper understanding of each other's needs. Also, don't underestimate how much physical health influences sexual function. Conditions like high blood pressure, diabetes, prostate enlargement, arthritis, or heart disease can all affect comfort during sex. But the good news is that many of these issues can be managed, and when they are, intimacy often improves. If you've noticed changes in your sexual function or comfort, you are not alone and help is available. A urologist or gynecologist can talk with you openly without judgment and offer practical solutions that make a big difference. Aging may change your body, but it doesn't have to take away your ability to enjoy closeness, affection, and intimacy. With the right information, a little patience, and support, sex can still be a beautiful and comfortable part of life well into your 60s, 70s, and beyond. As we age, our bodies naturally go through physical changes that can affect how sex feels. This is completely normal and nothing to be ashamed of. Understanding these changes is the first step toward finding comfort and enjoyment again in your intimate life. For women, one of the most common changes is vaginal dryness. This happens because estrogen levels decline after menopause, which reduces the body's ability to produce natural lubrication. When the vaginal tissue becomes thinner and less elastic, sex can start to feel dry, tight, or even painful. This is called vaginal atrophy, and it's very common after age 60. Fortunately, there are gentle and effective solutions such as water-based lubricants, vaginal moisturizers, or estrogen-based creams prescribed by a doctor. For men, physical changes often show up as difficulty achieving or maintaining an erection. This doesn't mean you're not interested in sex. It just means your body may need more time, stimulation, or support. Erections after 60 are often softer and take longer to develop, which can affect penetration and overall comfort during sex. Again, this is very normal. Medications like sildenafil Viagra or tadalafil Cialis can be helpful, but always speak to a doctor before starting any treatment. Another common issue for both men and women is reduced flexibility and joint stiffness, especially if you have arthritis or other musculoskeletal conditions. This can make certain sexual positions uncomfortable or even painful, but this doesn't mean you need to give up on intimacy. Instead, consider changing positions to ones that are more relaxed, use cushions for support, or try side lying position. that reduce pressure on the joints. Bladder issues can also play a role. For example, some women may experience a small amount of urine leakage during intercourse due to weakened pelvic muscles. Men with prostate enlargement may have urinary urgency or dribbling, which can cause worry during intimate moments. These conditions are not unusual and can often be improved with pelvic floor exercises, medications, or consultation with a urologist or pelvic health specialist. Also, sensation can decrease with age. Nerve sensitivity may dull over time, which can make arousal take longer or feel less intense. This simply means you may need more time and attention to build up arousal, and that's okay. Slowing down, being patient, and focusing on comfort and emotional connection can actually enhance the overall experience. It's important to remember, sex doesn't have to look or feel the same as it did decades ago to still be meaningful and pleasurable. With a few adjustments and an open mindset, intimacy can remain a healthy and fulfilling part of your life. You are not alone in facing these changes, and there are many ways to adapt. Speaking openly with your partner and a healthcare professional can make a world of difference. Your comfort and well-being matter at every age. Hormones play a major role in how our bodies respond to sex, and after age 60, those hormone levels naturally decline. This hormonal shift can affect desire, arousal, lubrication, and comfort. The good news is, once you understand how hormones work, there are safe ways to manage these changes and feel more like yourself again. For women, estrogen is the key hormone that supports vaginal health, elasticity, and natural moisture. After menopause, estrogen levels drop sharply. This can lead to vaginal dryness, thinning of the vaginal lining, and a decrease in blood flow, all of which can make sex uncomfortable or even painful. Some women may also experience less sensitivity or a decline in interest in sex. This is not a personal failure, it's biology. There are several safe and effective ways to help. One option is topical estrogen therapy, such as vaginal creams, tablets, or rings that deliver a small, localized dose of estrogen directly to the vaginal tissues. These can restore moisture, reduce irritation, and make sex feel more comfortable again. Many women over 60 benefit from this treatment, and it's something to talk about with your doctor or gynecologist. In men, the main hormone involved is testosterone. As men age, testosterone levels gradually decline, a process often referred to as andropause. Lower testosterone can lead to reduced libido, fewer spontaneous erections, fatigue, and mood changes. It may also contribute to weaker erections and less sensation during sex. Again, these changes are common and treatable. In some cases, doctors may recommend testosterone replacement therapy (TRT) for men who have significantly low levels and symptoms that affect quality of life. This can be given through gels, patches, injections, or other methods. However, TRT isn't for everyone. It's important to get a proper hormone evaluation and discuss the risks and benefits with a urologist or endocrinologist before starting any hormone treatment. In both men and women, hormonal changes also influence emotions, and that's important in intimacy. Feeling less confident, more anxious, or disconnected from your body can affect how you experience sex. Hormones like oxytocin, the bonding hormone, and dopamine, the pleasure hormone, also change with age, and that can affect emotional closeness and physical pleasure. But remember this, intimacy is not just about hormones. While they do influence the body, your mind, heart, and communication with your partner matter just as much, if not more. Many couples find that talking openly, slowing down, and focusing on connection helps reignite closeness, even as hormones shift. To sum it up, hormonal changes are natural after 60, but they don't have to mean the end of comfortable or satisfying sex. With the right information, medical support, and a bit of patience, you can adapt and thrive in this stage of life. You're not alone, and help is available. As we age, it's common to develop medical conditions that can affect many areas of life, including sexual comfort and function. Two of the most common issues that can impact intimacy after 60 are diabetes and prostate problems. Understanding how these conditions work helps take away fear and opens the door to safe, effective solutions. Let's start with diabetes. This condition affects how your body manages blood sugar, but it also impacts your blood vessels and nerves, both of which are important for sexual function. For men, diabetes can lead to erectile dysfunction (ED) because the nerves that control arousal may become less responsive. Blood flow to the penis may also be reduced, making it harder to achieve or maintain an erection. For women, diabetes can cause vaginal dryness and reduced sexual sensation. Some women may also experience more frequent infections or urinary discomfort, which can make sex feel uncomfortable. But here's the encouraging news: managing blood sugar levels, staying active, and using recommended treatments such as lubricants, moisturizers, or medication can make a real difference. Now, let's talk about prostate health. As men age, it's very common for the prostate gland to enlarge, a condition known as benign prostatic hyperplasia (BPH). While BPH is not cancer, it can press on the urethra and bladder, leading to urinary symptoms such as urgency, weak flow, or nighttime urination. These symptoms can disrupt intimacy by causing anxiety or physical discomfort during sex. Additionally, treatments for prostate conditions, including surgery or medications, may cause temporary or long-term changes in sexual function. Some men experience reduced semen volume, delayed ejaculation, or difficulty achieving orgasm. Others may notice changes in erection firmness. It's important to know that these side effects are common and manageable. If you've had prostate cancer treatment, such as surgery, prostatectomy, or radiation, you may have concerns about sexual function. It's true that these treatments can affect nerves and blood flow, but many men regain sexual confidence over time with the help of pelvic therapy, medications, vacuum devices, or penile implants. The key is not to lose hope. There are solutions tailored to every individual. Other medical conditions like high blood pressure, heart disease, arthritis, and even depression can also impact sexual health. In many cases, it's not the illness itself, but the medications used to treat it that cause side effects like low libido or dryness. That's why it's so important to speak with your doctor honestly. There may be alternative treatments or simple adjustments that can help. Remember, you are not alone. Millions of older adults are navigating the same challenges, and most find relief when they seek help. A warm, supportive conversation with a urologist or sexual health specialist can lead to small changes that restore comfort, connection, and confidence. Aging with medical conditions doesn't mean giving up on intimacy. It means learning how to adapt and knowing that comfort and closeness are still very possible with the right guidance. After age 60, sex can still be deeply fulfilling, but comfort may require a few adjustments. Many people find that using the right techniques, tools, and open communication makes a world of difference. In fact, with small changes, intimacy can feel even more connected and relaxed than it did in earlier years. Let's start with lubrication. This is one of the simplest and most effective ways to make sex more comfortable, especially for women who experience vaginal dryness after menopause. A good water-based lubricant can reduce friction, prevent irritation, and make intimacy feel smoother and more enjoyable. Some people prefer silicone-based lubricants because they last longer and don't dry out as quickly. If dryness is more persistent, vaginal moisturizers used regularly a few times a week can improve hydration and tissue comfort over time. And for women who need more long-term relief, low-dose vaginal estrogen therapy in the form of creams, tablets, or rings can help restore natural moisture and elasticity safely. These options can be discussed with a gynecologist or healthcare provider. Next is positioning. With age, joints may ache, flexibility may decrease, and certain positions that once felt natural might now feel uncomfortable or even painful. This doesn't mean sex has to stop, it just means finding positions that are better suited to your current needs. Try positions that allow for more control and less strain, such as lying side by side, using supportive pillows under the hips or knees, or trying seated positions where balance and pressure are more manageable. Communication with your partner is key. Take your time, explore gently, and focus on what feels good for both of you. Pace is important too. Many older adults find that slowing down enhances not only comfort but also emotional connection. Rushing can cause tension, dryness, or even injury. Taking time for longer foreplay, gentle touch, and open conversation helps your body relax and respond naturally. Now let's talk about communication. This might be the most important solution of all. Being honest with your partner about how you feel, what hurts, or what you enjoy helps remove shame and builds trust. For many couples, aging becomes an opportunity to reconnect emotionally and explore intimacy in new, meaningful ways. You might say something like, "I've noticed a little discomfort lately. Can we try using some lubricant? Or let's try a different position that puts less pressure on my back." These are loving, respectful ways to care for yourself and your partner. And finally, if you're unsure what's normal or you're experiencing persistent discomfort, don't hesitate to speak with a healthcare provider. Urologists and gynecologists are trained to help, and they've heard it all. There is no shame in asking questions or seeking support. In short, comfort after 60 is absolutely possible with a few simple tools, some patience, and a caring conversation. Sex can remain a positive, intimate part of life at any age. One of the most important things to remember about sexual health after 60 is this: you don't have to suffer in silence. Many seniors experience physical or emotional discomfort during sex, but feel too embarrassed or unsure to bring it up with a doctor. The truth is, seeking help is a sign of strength, not weakness, and it can lead to real, lasting relief. So how do you know when it's time to talk to a doctor? First, if sex is consistently painful, that's a clear signal. Occasional discomfort might happen due to dryness or tight muscles, but if pain becomes a regular issue, don't ignore it. For women, this could be a sign of vaginal atrophy, infections, or pelvic floor problems. For men, pain during or after ejaculation might indicate prostate issues or inflammation. These are medical concerns that can be treated once properly identified. Second, if erections are difficult to get or maintain, or if they suddenly change, it's worth speaking with a urologist. Erectile dysfunction (ED) is common in older men, especially with conditions like diabetes, high blood pressure, or heart disease. But ED isn't just about sex, it can also be an early sign of cardiovascular problems. That's why addressing it early is important for your overall health, not just your intimacy. Women should also seek help if they notice ongoing vaginal dryness, itching, or tearing, especially if lubricants aren't helping. These symptoms can make sex not only uncomfortable but also emotionally stressful. Many of these issues are easily treated with topical therapies, pelvic floor therapy, or simple medical adjustments. Another reason to see a doctor is if there are emotional changes affecting your desire or comfort, such as depression, anxiety, or relationship stress. Mental health plays a major role in intimacy. If you're feeling disconnected, overwhelmed, or ashamed about the changes in your body, talking to a healthcare provider or even a counselor can bring relief and clarity. Also, if you're starting a new relationship after age 60, it's wise to get a full sexual health checkup. While the risk of pregnancy may be low, sexually transmitted infection STIs can still be a concern. Safe sex practices and honest communication are important at any age. Most importantly, remember this: your concerns are valid. You are not being dramatic or too old. Ask for help. Sexual health is a part of total well-being, just like heart health or mobility. If something doesn't feel right, speak up, because comfort, pleasure, and connection are still very much possible. A urologist, gynecologist, or primary care doctor can guide you with compassion, professionalism, and respect. Don't wait for things to get worse. Early support leads to better outcomes and a more comfortable, confident experience moving forward. You deserve intimacy that feels good at any stage of life. Help is available, and you don't have to go through it alone. If this video gave you clarity or even a little peace of mind, please like, subscribe, and share it with someone who might be quietly struggling. You deserve comfort and closeness at any age, and I'm here to guide you every step of the way. Got questions? Drop them in the comments. I read them all, and I'm here to help.